So I'm Julie Strakota. I'm the Director of Clinical Education and Assistant Professor of Health Programs at Michigan State University's College of Veterinary Medicine. I partner with Dr. Christine Skelly from My Horse University to offer the MSU Equine Health webinar series. And I have the honor of introducing Dr. Manfredi this evening. So Dr. Manfredi will present Meet the McPhail Chair, Endocrine Disease in Performance Horses, More Than Just Laminitis. Dr. Manfredi is the Mary Ann McPhail Dressage Chair in Equine Sports Medicine and an Associate Professor in the Department of Large Animal Clinical Sciences at Michigan State University's College of Veterinary Medicine. She graduated from the Atlantic Veterinary College on Prince Edward Island, Canada, did an internship at Mississippi State University, and spent time in private mixed large animal practice and at 2 Chicago racetracks before completing a large animal surgery residency at the University of Minnesota. She completed a PhD at Michigan State in comparative medicine and integrative biology and became boarded in equine sports medicine and rehabilitation before joining the faculty. Her research interests include the intersection of endocrine diseases and osteoarthritis, sports medicine and rehabilitation of the performance horse, and rider, horse, and tack interactions. She has a passion for teaching and has been awarded the MSU Teacher Scholar Award, as well as being named an Academy of Veterinary Educators Distinguished Expert, and is a FEI level dressage rider. So welcome, Dr. Manfredi.
Thanks, Julie, very much. Well, good evening, everybody. Looking forward to a nice conversation tonight about endocrine disease and looking at what it does for laminitis as well as beyond. So I just first wanted to introduce myself. I'm relatively new to the position as the Mary Ann McPhail Dressage Chair. So I wanted to share a little bit about that and what I'm hoping to do for the horse community, not just the dressage community, but of course them as well. And so when I look at my position as the chair, this is a position that was funded generously by Mary Ann McPhail, who is a dressage rider, judge, and trainer. I want to look at really what we can do outside the sandbox to help everybody when they're actually performing on their horses. And so for me, there's kind of two roles here, a teaching role and then a cutting edge research role. And so from the teaching perspective, looking at how we can optimize training strategies, mentoring future veterinarians and researchers, and doing outreach events like this so that we can share all of our cutting edge research with the community that can use it the most. From the perspective here, from the cutting edge research, Dr. Dakota alluded to some of the things I very much hold close to my heart, including horse rider tack interactions, rehab, musculoskeletal, endocrine disease, etc. And so from there, I really want to get the horse community involved in my research so we see really what is important for all of you. What would help you and your horses the most? And so overall, I have rider, horse, and tack interactions interests, and whole horse health as well. And so today we're going to be focusing more on the whole horse health and how it can impact performance. And so I have some kind of interactive polling, which is fun for all of you at home. You can use the Q&A feature, but kind of some of these instantaneous polls, it's easier to see if you guys type it in at home. So if you want to join by text, you can type in 22333 into your like kind of numbers for the text, and then you can write Jane Manfredi 478. And then some of these interactive features will become available for you to use. You could also join in by the web, so you can log in on your phones on like a website, thepollev.com/Jane Manfredi 478. So I want to hear from all of you, either in the Q&A or through the polling website. What kind of areas would you like to see more equine research performed in? So whereas the new McPhail chair, can I really kind of address your concerns for equine horse welfare and well-being? So give that a second for a few of you to kind of join in. DSL, excellent. It's a devastating problem. And I don't know, Julie, if there is anything coming into the Q&A, we can look there too.
We have EPM and
EPM?
splint bone fractures and the long-term prognosis,
Okay.
navicular disease, and any new treatments or meds for that.
Okay. Fair. Good. Excellent. All right. Well, hopefully as we go forward, we'll get a couple more people joining on their phone to text in as well. Horse rider tack interactions. I see that from Danielle. That sounds great. All right, let's keep going. When we're talking about horse health and endocrine disease, I just wanted to kind of throw a picture of like a big item understanding that it's not just like laminitis. That is important, but endocrine disease causes a whole bunch of different clinical signs, changes in hair coat, muscle loss, adiposity or areas of regional fat, lameness and osteoarthritis, and developmental orthopedic disease, tendon and ligament injuries, and we're actually starting to see some placental dysfunction that might affect foals from mares born with EMS or endocrine disease. So lots of different things. And so I got interested in that from some of my younger horses and ponies that were maybe involved or had some of these issues as well. So that's kind of me as a very young youngster with kind of a formative pony in my life, Chablis, and then later on with arthritis with my horse Fawn down there. So before we dive into that, let's talk a little bit about what the endocrine system is. So the endocrine system is a series of glands and hormones that are responsible for basically like the maintenance of the body, blood temperature, pressure, hair coat, sugar growth, metabolism, production, all those things. And so today, the kind of areas that we're going to be focusing on are the pituitary gland, so in the horse's brain, as well as the pancreas. And so the idea with endocrine disease essentially is that you have these glands that are releasing hormones, which are kind of chemical messengers that go into the bloodstream and then find target cells or organs throughout the body. And that contributes to kind of like the maintenance of all the systems to keep us going or keep your horses going. So today we're going to focus on things that revolve around hair coat, blood and sugar and insulin, as well as musculoskeletal system. And so everybody here, which horse has endocrine disease? We have kind of a couple of examples up here. We have my cousin's 13-year-old pony gelding. I have myself and my 15-year-old Welsh pony mare. We have 17-year-old Dutch warmblood mare. Guys, put your guesses. Who has endocrine disease? You can throw them into the Q&A. So the 13-year-old. Perfect.
Yep.
Yep, we have a vote for that. Anyone else? A lot of 13-year-old ponies coming up. That's good. All of them. Sarah Buffman is probably going to be the winner in this situation. Definitely the 13-year-old pony gelding, though, for sure, is the classic poster child. Ponies on the whole are known for their endocrine issues, so that is good. But possibly all of them. Kathy, you hit the name. And then Carrie Ann has inside information because she owns the pony in question, who is looking much better now with much effort on her part. So excellent. Thanks, cousin. And the gelding and all. Good. Excellent, everybody. So definitely the 13-year-old pony gelding had some issues with metabolic disease or insulin regulation. I'm forgetting right now if he also had Cushing's disease, but definitely he had that. The 15-year-old Welsh pony mare, I put there intentionally was in late May, so you guys can see she has kind of a pretty hairy coat and sweat. So she had Cushing's as well as metabolic disease. And actually, my mare here over on the right, who this was just taken at regionals a couple years ago. We just finished our, I think, Pre-St. George or I-1 or whatnot. And she actually has PPID, even though she looks pretty good. So we're going to talk a little bit today about how horses can still have endocrine disease, even if they don't necessarily look the part. They could have early stages of it and how we can figure that out and hopefully ward off bad problems. Thanks. So they all do the answer. So the main equine endocrine diseases are pituitary pars intermediary dysfunction, or PPID, and formerly it's been known as Cushing's, but we're kind of moving away from that nomenclature. And then equine metabolic syndrome or insulin dysregulation, which I'll often refer to as EMS-ID, which used to be known as insulin resistance. And I'll explain a little bit about how those name changes happen and what they mean. But now we look at insulin resistance as being kind of like a sub-syndrome of this problem. So how many of you have heard your friends are worried about the thyroid in your horses? hypothyroidism in horses. Um, oh, good. CPL, management of the disease. Good. Um, hypothyroidism. So we'll touch on this just briefly now. And so I will say in adult horses, it's very truly rare to have true hypothyroid or thyroid disease in adult horses. Um, and so you can see it in foals, but in adult horses, basically testing for thyroid function 99.9% of the time is wasting your money because there's a lot of reasons why it can be low, including they're older, it's morning, they've been exercised, they're on bute, they have another illness occurring. So today we're really focusing on these first two because thyroid disease is pretty rare in the adult horse. Okay, so we'll go into this picture here too. So looking at this horse, does this make you worried about anything? So looking at this horse, knowing this is like summertime, does that make you worry about a certain problem? So again, you can type it into Q&A or you can text it to me. Again, type in 22333 and then Jane Manfredi. Seeing yes, we're worried about Cushing's and PPID. Okay, perfect. And what would be a really outcome of concern? Yep, their coat, that hairy coat that's extra like formed. Metabolic disorders, perfect. And what would be a really bad outcome to come from having this uncontrolled PPID or metabolic disorder? What would you think would be one of the things you're most afraid of? Laminitis, thank you for those putting it into the text. Excellent, perfect. So I agree, this horse back here definitely had the classic hirsutism or like really long, shabby, curly coat. And so you would be concerned about that. I would say his body condition score, potentially, a little hard to see that because we don't see his neck. But Rebecca, oftentimes those go hand in hand, and we're absolutely going to want you to look for both in your horses. Perfect. Okay. Good. And so if we're looking at things here, this is kind of the classic stance for a laminitic pony once things are really undergoing and painful. And so he has kind of this camped out appearance. And then horses that have chronic issues with laminitis often have rings within their hoof wall and can kind of have like a slipper toe on their shoe, on their foot. So these are kind of chronic changes that can be devastating. So when we're looking at radiographs, which one do you think, the left side or the right side, which one is the normal radiograph or x-ray up the side view of the foot? The left side or the right side? You guys can put that into chat. Or into the Q&A rather. Good, so a bunch of lefts are coming in there. Excellent, good job everybody. Thanks Julie for clearing those as we go. So when we're looking at that on radiographs, what we're trying to see here is that you want to have the bone in the foot. So the coffin bone, which can be seen here on the left, should be parallel to the hoof wall. And so you can see there's a 0-degree angle there. So those are roughly parallel versus in cases of laminitis, and this is a quite advanced case, we can see that in fact, we do have probably in this case, I would say there's probably like 12 or more degrees of rotation where that coffin bone is now separated from the hoof wall. So we're having the kind of lamina that tie them together really kind of inflame and separate. And so we have now the coffin bone pushing through towards the bottom of the sole, which is amazingly painful. So why do we care about laminitis in horses? Well, it can be devastatingly and painful, and we know it can also be something that is created or happens secondary to high levels of insulin. So we're talking about issues with metabolic syndrome and insulin dysregulation. And so the one thing I want to put a plug in here for is that if you guys can see, what's this tool at the bottom? What is this person doing right there? You can put it into Q&A too. What is that individual doing right there to that hoof? Good, so doing hoof testers, exactly. And so I really highly recommend that people have a good quality hoof tester at their house as part of their first aid kit for their horses. And where he's putting pressure there at the tip of the frog, that is actually the location right here underneath basically the tip of the coffin bone. So if it was to rotate, that would be the position that we would find the most pain from on hoof testers to happen. And so when we look at laminitis, we know endocrine disease is the #1 cause of laminitis in horses and ponies. So over 90% of the cases are due to endocrine disease, such as Cushing's. And on the left, we can kind of see the stereotypical horse for that. where for PPID, they have that irregular hairy coat. They have a lot of muscle atrophy along their back. And then over here for EMS and insulin dysregulation, again, we have kind of the classic appearance where we have an overweight horse who's generally fat and then also has kind of areas of regional adiposity or regional areas of fat that you can see over by his shoulders, by his neck, and probably by his tail head too. So again, horses can look like this and be normal, and horses can look like this and have a lot of problems. And there's some horses that look totally normal and still have endocrine disease. So yes, we are much more worried when we see them walk up to us like this. But as we start to get older, we start to worry about both of these in a little bit more detail. So we talked about laminitis, but what I'm hoping you guys can take away from tonight is that we can actually have other issues that can be secondary to some of these endocrine diseases, such as sinusitis, hind limb proximal suspensory dysnitis, and DSLD, or breakdown of the suspensory ligament behind. So again, it's just multifactorial, like it can affect endocrine disease, can affect many, many systems. So one thing I wanted to call your attention to, this is a diagram from the Equine Endocrinology group. And so this is a really great website that basically the top researchers in endocrine disease for horses in the field kind of keep updated. We have kind of meetings every couple of years, and actually we'll put out statements about the two, multiple endocrine diseases and what's the current research showing. And so what we can see here is that if we have insulin dysregulation, PPID, and obesity, we're kind of increasing our laminitis risk when we have all of these come together. So we'll start diving into equine metabolic syndrome a little bit more, and then we'll move on to PPID, and we'll talk a little bit about it, some common or some issues that can happen associated with it, and then treatments and diagnoses. And so we know EMS, or insulin dysregulation, is a cluster of clinical signs. So if we look at this pony right here, we can see it's quite the crusty neck, like we could kind of cup that in our hands. That's much more than a normal horse should be. And so when we're looking at these creatures, we're also looking at their body condition score. How many of you regularly body condition score your horses? Go ahead and, if you're willing to say it, you can answer it in the chat. Or whatnot. But that's something we should be doing several times a year, especially coming out of winter, just to see where our horses are and how we can get them to the most optimal body condition, which is normally a 6 or so. And so when we do that, we're actually putting our hands on and touching them. Good job, Nancy, 3 to 4 times a year. Great, great, Beth, to see that, and everybody else that's answered. Can we feel their ribs? Do we feel a pocket of fat behind their shoulders? The neck, is it smooth, or can we cup it like in this horse here? Do they have a trough down their back? All those things we're looking at, because we know increased adiposity or weight is really bad for all of their joints, as well as endocrine issues. And so when we're looking at these horses, we are looking at them to see if they're insulin dysregulated, because we know that high levels of blood insulin can lead to laminitis even in normal horses. So if we took a normal horse, like a standardbred, for example, and we just infused insulin in, we could make that horse founder, unfortunately. And so when we're looking at there's 2 ways to look at it. It could be a tissue level problem, so like within the muscle or the tissues, or it could be something that happens after a meal. And I'll talk a little bit more about those 2 in a minute. So one thing when your body conditioning score that often goes along with it is weight taping your horse. And so when you weight tape a horse, typically that's where this blue line is in that top right picture, and you're putting a weight tape around and it gives you an estimate of the pounds that horse has. However, we know that can be a little bit misleading sometimes. So say, for example, you had a horse that had a really crusty neck and had a lot of fat there, that weight tape wouldn't account for it. So I actually recommend, if we're really trying to track progress with their weight, that there's a really good app called the Healthy Horse app. It's run by Minnesota, which takes into account a horse's neck circumference, the girth circumference, or height, length, and breed to really get you a more accurate weight for your creature. Oops. Okay, good. So again, feel free to either text in or put it in the Q&A. What breeds are to be at risk for insulin issues, EMS, insulin dysregulation? What breeds are you really worried about? I know already there's a couple of you who came in the Arabian #1. Good job on that. Pony breeds, drafts, some warm bloods, yes. Minis and ponies for sure. Where's my little halflinger friend? Arabians, Tennessee walking horses, the gaited horses. Um, Ponies are definitely more prone. They're definitely the poster children we worry about. So ponies, Arabians, perfect. Some giraffes, good. Morgans, very good. Um, Halflingers, yes, halflingers, Morgans, good. You guys you're getting it, all your concerns right there. So yes, we do worry about other breeds, but we know there's some that are genetically a little bit more predisposed, and that up to anywhere between 20 to 35% of their risk can be determined by their genes. So the quarter horses is interesting, Linda. So thank you for bringing that up. There is definitely a certain population of quarter horses, and we're trying to figure out why that are at risk. Most of the quarter horses are pretty safe because they have a lot of muscle, and muscle is what really uses the sugars and the glucose in your body very well. But there's definitely a subpopulation of the quarter horses that are at risk. And right now, there's a couple of us at 3 different schools trying to figure out why that is. So hoping we'll have more details about that in a kind of a year. Perfect. Arabians, Tennessee's perfect. Love to see some of those things come through. Excellent. Good. All right. So at-risk breeds for EMSID, just some examples, your ponies, your Arabians, your giraffes, your Morgans, your walking horses. And again, I meant to put a picture of my halflinger friend up here, but I'll do it for next time. So I think I mentioned before a little bit about insulin dysregulation, and we now kind of break it down into 2 areas. One type of insulin dysregulation is this tissue level problem. So a horse eats sugar starch or this fresh grass, glucose enters the bloodstream, and that would be a kind of this like little yellow dot. And then in order to get the glucose into the cell, we need to release a lot more insulin to make that happen. So instead of just 2 or 3 little circles of insulin, we have to do about 8 or 10. The other half of this happens after eating. And so what happens here is the horse eats the grass, the glucose is released into the bloodstream. The pancreas releases a normal amount of insulin, but after it gets processed in the gut, there's hormones in the gut that actually have the pancreas release even more insulin, more than you would typically need. So both of these cause the problem. So why do we care? So we talked about laminitis so far, but other things that can happen is developmental orthopedic disease. So in our babies, how many of you have had a horse or heard of a horse that got osteochondrosis or OCD, osteochondrosis dissecans? Have you heard of that before, any of you? You can answer in the Q&A. A couple, yes, yes. No, Kathy, well, I will definitely share this for 2. Good. So a couple yeses, a couple no's. So what this is there's like a failure of the cartilage to turn into bone, and then you can have this little kind of piece of cartilage less mineralization floating around in the joint, which can create issues with arthritis and irritation. And so in what we saw in this one paper was that at a year of age, babies that were born to mom that were obese or had issues with insulin and glucose had a lot more different cases of having this osteochondrosis problem. So in other words, if your mom had EMSID, you were more likely to have joint problems as a yearling. And what we also saw is if we did some testing, we actually saw that these foals that were born from these obese mothers also had problems with insulin already at a younger age. And so one of the things that my work is looking at is why this might happen. Why are these foals so much more at risk? And so one of the things we wanted to look at was actually the placentas, because we know that women that have gestational diabetes have problems in their placentas and their placental function. And so what this graph shows here is a little bit of placenta. And we kind of have circled this kind of like glob of circular tissue that has like some extra vascularization or blood cells in it. And so in a normal case, this would look like a smooth, like finger-like structure. And here we can see it looks more like a cellular, roundish oval cellular feature. And so when we looked at this placentas on histology, and we looked at a bunch of different factors as seen here, we can see here in blue that mares that had issues with insulin had a lot more negative changes in their placenta that could potentially drive that. Linda, does any of this link to PSSM? Um, right now, this part doesn't necessarily, the mare placental function. So a lot of those breeds can have issues with PSSM, like the quarter horses, the halflingers. Um, and so there's not necessarily an explicit link yet. Some of these can co-occur though, so they can happen at the same time. And so when we're looking at performance in those horses, we're looking at what is their endocrine status? Do they have muscle disease? Because that can really compound issues. Thanks. Anyway, so we're looking at this right now in a bunch of Arabians. This was luckily funded by the Jockey Club. So heart disease. So in humans, we know that humans that have a type 2 diabetes, which is very similar to insulin dysregulation, have heart failure and heart attacks. And what we've seen is actually in draft horses too, they have a lot of fat. So you can see the white and the yellow areas here, a lot of more fatty infiltrates. And you can see when we actually cut the heart tissue that there's actually little white globules of fat within the heart tissue itself. And they have thickened vessels. And then we know ponies with this problem have increased blood pressure. And then we know that there's some hypercoagulability in these obese ID horses. So horses have cardiovascular disease. Now, normally something else gets them first, but this could be a problem, especially in some of our higher performance horses that are asked to do more and more. All right, so let's get a little bit into testing for this now. So we're going to play a little bit of a game. You guys can, again, put it into the Q&A your answer here. But if I were just to do like a fasting baseline blood test in the morning to look for insulin levels in horses, what I want to know is, say, for these M&Ms, there's 100 horses. There's about 100 M&Ms. If all the blue M&Ms here, so there's about 25 blue M&Ms here, truly had issues with EMS or their insulin glucose regulation, if we just did this fasting baseline sample for insulin, how many of these horses do you think we would find? So would we find 1, 5, 10, 20? So I think you go ahead, you can either vote here or you can type it into your guess into the Q&A. So of those 25 horses that truly have it, you think Phyllis thinks we'd find all 25 with our resting baseline blood sample. So we have a kind of a vote for 15, 10, 5. Give it another couple seconds for you guys to all place your votes. 5, 15, 10, 18, 10. Excellent. All right. Give it a couple more seconds. So again, so mostly D, yeah, perfect. People are saying 10, 15. All right, that's seems to be the consensus. Somewhere between 5 and 15 seems to be what it would find. All right. So I did some research on this a few years ago. And actually what we found was that you would only maybe find one horse of those 25 that truly had problems regulating. Okay. And so that's bad. That means we missed potentially like 24 horses that really needed to be on a different diet and exercise regimen to not have problems that we just talked about between laminitis and other musculoskeletal issues. So just your fasting baseline blood, you'd only maybe find one horse. I think we can do better than that. I hope we can. And so we now know we can do that. And so this is where I think a couple of you emailed me or texted me before the talk saying like, hey, I'm a little worried about my horse. The blood work, the fasting baseline blood work looks fine, but it's starting to get a little crusty neck, a little, fat in a few places. I'm really worried, like, is everything still good? And so what we now know is that to really find more horses that truly have this problem, we need to kind of do what we call a dynamic test. And so basically, I don't know how, a certain population of you, maybe if you were pregnant yourself, you had to go in and you had to drink the really sick, sweet, sugary drink. And then they checked glucose through time to see if you had gestational diabetes. We do a similar thing for horses, except for we look for insulin because that's what changes the most in horses. So in horses, we kind of hold them off feed in the morning. We give them a kind of a large glug, like 80 mils of Caro syrup by mouth. And then we take blood at 60 and 90 minutes to look for insulin. It is similar to that glucose, the oral glucose tolerance test in humans, Nancy. So that's really close to what we do. There's an IV form of it that it'll do in humans, but in horses, we really think that this oral challenge is the biggest, like, kind of way to tip into laminitis, that it's something in their diet that they get, and then they have those hormones released in their gut to increase the insulin, and that really is what kind of perturbs horses or pushes them into a laminitis event. So when we test them, we want to test them similarly, but with a like smaller dose of sugar so it's safe. So in this case, we give them a little bit of that Caro syrup and then take those blood samples. And if it's more than 45 microIUs per mil or look like it's going to get there pretty closely, then we say those horses actually truly do have a metabolic disease issue. And so I have had many, many horses that on baseline blood look fine, but when we actually do this challenge test, actually show us, no, truly they do have issues. And so for veterinarians in the field, I really do recommend that they do this test on horses that we're really concerned about because it's a higher sensitivity. So, for example, before with the baseline blood, we only found one horse that had the problem. After doing the oral sugar test, now we're finding 18 to 20 of the horses that truly have an issue with this. And that's a way better number. It makes me sleep a lot better at night, knowing that could be good. And so the oral sugar test, Catherine says, hay and grain withheld or just grain. So definitely grain for sure. What people normally do is like they'll give like one flake hay at 10 p.m. and then essentially what's left overnight is what they have. There's been some work to say if they're just getting hay that morning, it doesn't have too big of an impact. But I try to say like, let's pull this first thing in the morning. Sometimes we have the owners or we have you all give the Caro syrup and then we just come out to pull blood at 60 and 90 minutes because that's a lot easier for veterinarians to do instead of being out there for like a full hour and a half. So that's kind of another perturbation. But this is something that really I would love if you all as clients would ask us to do because sometimes we feel like, oh, we're putting them out. This is a little bit more testing or whatnot, but it's really a better way to diagnose the problem in your horse. So Christine's asked, can you do feed normally grain included and do an insulin check? And so you can do the grain to see how they react to the grain that you're giving. So it's kind of like an in-feed test. There's a little bit more variability because some horses take longer to eat the grain than not. And so with those horses, I do normally do 60 and 90 minutes. Sometimes I even do 120 minutes after. And again, you would probably use the same kind of threshold. I typically, Christine, like to do the Caro syrup test first and then make whatever changes to the diet that we think is needed. And then 3 or 4 months down the line, check after the diet has been changed to make sure this diet is appropriate for that horse too. So I'll use them sometimes together to figure out the issue or if there is a concern. So that's a good question too. Good. Excellent. How many of you have had an oral sugar test performed on your horses before? Can I just have a yes or no in the Q&A? So I'm seeing quite a few no's. And what I'm hoping is that, you all can, like I said, go back and chat to your, some yeses, chat with your veterinarians and say, hey, I heard about this. Is this something, we can try and do or consider for my horse? If you know that there's either a concern you have or they're an at-risk breed. Miniature horses are also on that list as well as donkeys, etc. Perfect. We'll get back to the part that's empty in the next section of the talk. So for what we do for treatment for these horses, so the mainstays are diet and exercise. And so we want to have a diet that is low in non-structural carbohydrates, so less than 10%. So sometimes to achieve this, we actually have to soak the hay. Just remember, if you soak the hay like being done here in this bucket on the top right-hand side, you take the hay out of the water and you feed just the hay itself and not the water where all the sugars have leached out into. Eliminate grains and go move towards more ration balancers. But I will say there are already some ration balancers that are lower in protein that are more desirable. So Buckeye, Essential K, that are at least, lower than 30% protein, because we know protein itself can trigger spikes in insulin. Some horses actually do well with about 50% or less of their roughages being wheat straw. And overall, we want to have these horses lose weight too, so they become into an ideal body condition that can also help with their insulin. And the more they exercise, the more muscles they build. And remember, I mentioned before that muscles are a really big one for using glucose or sugar or energy. So the more muscles you have, the easier it is for you to kind of like regulate your insulin and glucose. And so one way we're looking at kind of doing that is, potentially, especially with horses that maybe have had laminitis or have other orthopedic diseases where they can't do as vigorous of an exercise as before, is resistance bands. So this is an example up here. This is the Eagle Pro 6, but there's also Equibands and other things too. And we're looking right into now is can we actually use these resistance bands so they can work harder at lower impact to help those horses. Let's see. Good. So yeah, so Kathy, just regarding the baseline test. So if your vet starts with the baseline test and it comes up normal, but you're concerned because again, you mentioned he has crusty neck and fat deposits, I would say they need to come back out and do an oral sugar test. I would highly recommend it because you can miss so much without doing that challenge test. Okay, perfect. So one of the I was just at a conference in January where we had like a lot of those experts we were talking to before in the field about, the current research. And there's a lot coming out about pasture and non-structural carbohydrate content. So this was done actually down in Kentucky. And so overnight, the NSC is low and it starts to climb at 8 a.m. And at 7 p.m. it peaks for NSCs. So if you're turning out your horses, you don't want to, and you're worried about them, you don't want to really have them turned out like around this peak. You want them turned out like even maybe later at night. So it's really low, kind of like at the lower times. Or you want to consider, is there another option, dry let or other things for that horse if you can't control that. So, either that or you just turn them out earlier in the morning, starting at about, 7, 8 right after feeding, and then, pull them in close to noon or 1. So again, it's the kind of balance of they need exercise and turnout, but we don't want to put them at risk. And we do know that there can be a great deal of change in the sugars throughout the course of the day. So basically in Kentucky, at least, the springtime, the NSCs looked 24%. So pasture was not safe pretty much at any point in time. And then in late summer, like 5 to 11 a.m. were the time periods where it was safest for horses to be turned out on grass. And so if you did have to move your horse to the dry lot, within 24 hours of doing that, you could always already see improvements in insulin. And so horses that really are having trouble and can't manage themselves on pasture might be ones that you move to a dry lot and consider, do you mix in some wheat straw with your low NSC haze as it is? Okay. So probably many of you in the audience have had horses on metformin or Thyrin L. Those are kind of like the older EMS treatments. I will say metformin is really poorly bioavailable, so many horses show no improvement at all with that. Thyro-L, some horses do, and we think this is probably because they lose weight. However, we now know that actually some horses can get arrhythmias on Thyro-L. And so for me, if I have a performance horse, I get really uncomfortable about giving them something that could cause an arrhythmia, especially if there's riders that we're worried about. Okay. Some recent, or not a few years ago, I did this work too, where I was actually looking at a combination of resveratrol and amino acids to look at horse health. And so basically the company said, here's a bunch of product, test it. And I said, okay, I'll test it. I'm publishing whether it works or not, I'm going to publish it. They said that's totally fine. And we actually did see that horses both lost weight as well as improved their insulins after being on insulin wise for about 6 weeks. So we can see here we did an oral sugar test. And before we started it, we were up in orange. And then after the 6 weeks, we had kind of lowered the insulin responses to an oral sugar test. And then very excitingly recently, for horses that are either acutely laminitic or for ones where you're doing all of the things and they still can't get their insulins into the normal level, we can actually use SGLT2 inhibitors, or they're called Flozins. It's a human-based drug, and so it basically helps them pee out their sugar. And so if you have less glucose, you have less insulin spikes. And this has been like really, really positive. Cons, it can be a little pricey. You're worried about you might have to keep the horse on it in life if they're not responding to the diet changes. We do know some horses can like lose a lot of weight. So like more than you would necessarily be comfortable with from a cosmetic perspective. But we do know that by about 2 years in, they'll return to their normal weight as well. There are some effects with some of the blood work changes. So we do have people monitor their triglycerides, but even though they seem to get a little bit high, horses still seem to be able to just deal fine and don't really have clinical problems. So this is kind of an exciting treatment to add into diet and exercise as well. And then finally, some other kind of exciting work that my lab just did. How many of you have heard about laminitis occurring after steroid injections? Essential K is a lower protein ration balancer, so it's like I think like 28. So it's not like the 32 that some of them are. Sorry, just catching up on my Q&As. Yeah, so a couple of us had heard that. So when I went through school and even in my residency, I heard like, oh, that's just like, a story that people tell and it's really not an issue, or we don't think it's really an issue. That's just, it happened once or twice and things happen. It could be just, correlation. So myself and my collaborator, Amy Colbath, really wanted to see, do we spike insulins after steroid injections? Because it can happen in humans. And so we had horses that had some joint injections into their knees. And what we did is we did oral sugar tests on these horses beforehand to see if they were prone to metabolic disease or not. And then basically we wanted to look at and here in normal horses versus horses that, normal horses are in black and horses that have insulin issues are in purple squares. We can see that the insulin was way higher in these purple squares in these horses that we knew had insulin issues. And we honestly normally like to keep any insulin to like definitely below 100 and even below 50 would be better. You can see a lot of these horses 3 days after are in a very scary range, a range where you could have some cases of laminitis happen. So my background story from this is essentially if you have a horse that you're worried about EMSID, don't inject triamcinolone into the joint. Now, there may be other steroids that are safer, but triamcinolone does not seem to be one of them. All right, so any questions in the Q&A about EMS? I can take a couple of those before quickly going on to PPID. So contraindications to insulin wise. So there's not to me, there's no contraindications to insulin wise. The one thing I will say is that you do need to have Cushing's under control if you're going to treat them with insulin wise, because if the Cushing's is not under control, sometimes they don't improve their insulin as much. And I would say kind of for any of the horses for insulin wise, if you do an oral sugar test, you treat them for 6 weeks, then retest to make sure you're making progress. And if you are, great. And if you're not, then maybe we move on to the Flozins or another intervention. Okay. All right, so about 5 or 7 minutes left just to talk a little bit about Cushing's. So Cushing's is an age-related disease. So 20% of the population over 20 has it. It's a benign brain tumor. And basically, it messes up the part of the brain so that they basically think it's winter regardless of the time of year. So clinical signs are that hair coat that you all identified, top line muscle wasting, laminitis, increased urination, weird degrees of sweating, and abnormal fat. Good. So just I'll remind me to talk about the insulin, the wellness ready thing at the end, Julie, if you can. We'll talk about that at home analyzer. So one of the things we've come to see, though, with Cushing's disease is that there's an association between PPID and suspensory ligament degeneration. So suspensory ligament is the ligament here in yellow that you can see cups the back of the fetlock and really helps hold the horse's foot up. And so when we have degeneration there, we have the picture kind of like at the top right where we see this dropped fetlock appearance. And so we know that if you're looking at the suspensory ligament itself in horses that have PPID, the normal ligament is here over in A, but if you get over to D, you can see no longer are those lines parallel. So there's really not a support system anymore. And so in these horses, we're really concerned. And so we think perhaps if we recognize PPID sooner, and start treating them with Presend, then perhaps we can prevent this from progressing. So top line atrophy is one of the things we're worried about. I think I alluded to this a couple of years ago. We were talking about with back pain in horses. Can you imagine if you have top line atrophy and you still have to have a saddle and jump big jumps? And so we did some work looking at saddle pad pressures, and we know that on the landing, we can get pressures that are really in the range that would really cause back pain. And so if you have even less muscle to support it, then you could have even more reasons for back pain. And then finally, an interesting one. Why don't you all, you can either type it in here. What do you guys see anything strange about this horse's face or eye? You can also put it into the Q&A. There's a essential K Raschenballer's light, Phyllis. I pulled up this morning that it's not 31.1, so I can look that more up later. But the Buckeye is definitely lower than that, and the essential K I was looking at earlier, the light needs is about 28.
I just looked it up too. It's 28.
Yeah, thanks, Julie. Good. So someone was worried about the fat above the eye. A couple of places. Tearing, yes, Rebecca, this horse definitely has some tearing. Perfect. Good. So I'll just show you some things here. So he has some tearing there, and then he also has kind of a little bit of a bulgy area here, which is a little bit interesting. And so above his eye, he has kind of a weird fat deposits there too. I will give you that, Beth, for sure. And so normal radiographs kind of look like this. So if you look in the area with A, there's kind of like a little bit more black, which is more air, consistent with air. And in this horse's radiographs, you can see they looked kind of like more gray and hazy. So he actually had sinusitis. So what happens in his case is that he had foodstuffs getting up through holes in between his teeth and packing his sinuses with food. And so when they did that, they were kind of blocking the tear duct here, so it couldn't drain out his nose, and instead it was tearing out his eye. So they had this kind of a fistula, which can be a problem. PPID also is known to be prone to showing horses having fractures, and they actually have decreased bone density in their vertebra. And then there's kind of controversy about whether or not they have issues with parasites. And so similarly to EMS, we actually have a challenge test we can do for Cushing's called a TRH stim test. So we can only do it in certain times a year, but if you have a question about whether your horse has a problem, I highly recommend we actually do this stim test, where essentially we inject a hormone and we watch for their responses in their blood to really see if your horse has a problem with Cushing's or not, or PPID. The sinusitis issue is really pretty, like, issues with teeth are really common, Rebecca, in older horses, and then they can progress to sinusitis. So the teeth issues is like pretty prevalent in older horses. It doesn't have to progress to sinus disease, but it can. So treatment for PPID is Presend, building up their exercise strength, and then there's some rehab activities that we can do too. So I'll show you for these horses, I really like to build the top line, and I'll kind of do a combined like sternal lift and tail tuck. So at some point I do a lot with rehab, also happy to do a talk about that at some point in time in the future as well, to rebuild their top line. I'll just throw this up there. Some thin horses can have insulin dysregulation too, and then it's really hard to balance their caloric needs, but we can do that through adding a lot more dietary fats. And then just wanted to end with a couple slides about acute laminitis treatment. Again, hopefully tonight I've shown you there's a lot more things that we can worry about, but laminitis is obviously devastating. And so the top thing that we can do is continuous icing, and we know it needs to be submersion. So there's like soft ride boots you can dump ice in, jack boots that are able to put ice and water into, or just sanding them in like large buckets. Of course, this is a little harder for their personality, but really this continuous icing and not on and off icing is important. Anti-inflammatories, starting them on these SGLT2 inhibitors or Flozin, stall rest, and eliminating all their grain. Ultimately, with farrier care, we want to kind of rearrange the hoof to kind of derotate things, trimming off excess toe and heel. And very commonly, if you come into our clinic here at MSU, we'll have them in clogs or wedges that help them find the most comfortable position to hold their foot in. So with that, I'd like to thank everybody and start taking some questions. And I will have you guys kind of put them in the Q&A. I already will touch upon the wellness ready insulin monitors, and there's actually another one as well that has come out most recently. So what those are stall side insulin assays. And so I will say insulin is a really hard thing to measure. And so with those assays at the moment, I will say if they are high, so if they're 50 plus, you probably truly have a horse that has an elevated insulin. If they're like less than 50, we're not quite sure. So it's a good quick check. And if it is truly elevated, it probably is elevated, but it's not great in the sense if you're tracking things over time, like the repeatability can vary. So for example, if I'm running, say, the same blood sample at multiple times, like one time I might get 50, and on the same blood sample, if I ran it again, I might get 80. And so if I really wanted to kind of say, look over time at responses to diet and exercise changes, I would want to send it off to a lab such like MSU or Cornell. Of course, I'm going to say go green because I'm here at MSU and we have a top-notch endocrinology lab, but I admit some people do send things to Cornell. That's fine. Julie's laughing. But you probably want for repeated follow-up to be sending it to the same institution and preferably a professional lab at this time. So again, I'm working with one of the insulin companies to try and see if we can get it more repeatable. But we're getting closer, if that makes sense. Let's see. Okay, so TR stim certain times getting the intergroups hurt. So the TRH stim, Amy, we know is most effective to be done like basically January through June. So then after that, we have fall times where the elevation in ACTH occurs naturally. And so we are working on coming up with what we could consider normal values during that time frame where we have kind of a natural spike in the ACTH. But I don't think those have been finalized yet. Perhaps maybe they have just recently, but it would have just come out. But I don't think so yet. So for the most part right now, we normally TRH stim them January through about June. We do have year-round values for baseline fasting blood for PPID. And so we do look at that if it's like we're happening to pull in October, November, December, we'll look at that because then if those are above a certain level, we'll say, okay, this is far exceeding what we would expect this time of year. Hay gain meta safe at 12.5% protein. I mean, that protein is within a normal or reasonable range, so that wouldn't concern me, Sarah. That would seem to be fine. Can you feed? Yes. We can answer that one before. Let me make sure. You can ask this later. If a senior horse, no, if a senior horse is getting regular dental care, Rebecca, absolutely. That makes it less of a concern because hopefully your veterinarian is picking up if they have these gaps between the teeth where they could have sinusitis occurring. So what happens is like they get gaps between the teeth and then they get food stuck there. And then with time, if the food is not removed, it can irritate the gingiva and it can actually kind of eat away and then head up into the sinus. So yes, absolutely for our older horses, regular dental care can definitely help it prevent it from getting to be a sinusitis issue. So good point, very good point. I can go back to the other feed recommendations and show you those for a second, Sarah. Hang on. So I'll sit here for a minute on the thin horses with the ID and we can go back to the other ones. Okay. Done. Are amino acid supplements triamine, smart muscle mass, harmful, helpful? So, yeah. So for Karen, if you have horses that are having trouble regulating their insulin without the amino acid supplements, then I would not necessarily want to be adding those in. What gets tough is if you have like a horse that has myofibrillar myopathy or muscle disease, where the amino acids and the building blocks of the muscle are really important. You kind of have to kind of counterbalance it. The main one there we would worry a little bit about is more like arginine, high levels of arginine, because that can trigger insulin too. So some of the other amino acids may not be an issue, but that was the case if you needed a horse to be on those, I would say that's when we go back to what one of the other caller's commentary is can we actually then check it after we just feed them the diet that is what they normally get? And so then I would say, okay, let's feed the meal with the supplements in it. We'll check blood, 60, 90, 120 and see can that horse handle it? And if they can't, we can repeat the test without giving the amino acids the next time and see if that was what is putting them over the edge. If that makes sense. Good. And then Nancy, Richie, yes. So Richie has DSLD, is on Essential K at 1.5 pounds per day, no other grain. Is there something else that you would suggest? So right now with DSLD, and I think Nancy, you checked him with the TRH dim and he was normal there too, I think. So he becomes a trouble child because it's a terrible, terrible condition with not like great treatments. So the one thing that has been shown to help with DSLD is if it's early enough that they can still get a moderate level of exercise, that can still really help them. But once they become more advanced, we run out of kind of like options to keep them in performance or work. So we can also have kind of shoes that have, a little bit extended heel support in the area. But dietary wise, I mean, he needs just to be on like a good vitamin mineral mix for the most part. I don't remember, I don't think he had issues with insulin or glucose, and I may be forgetting that. But yeah, he's worked 4 times a week. He's on PLR. I mean, Nancy, you were doing your best possible things for him. I wish he was like Cushing's where I could say, well, let's start percent and that could help ward it off more. But I think his PPID on the TRH dim was normal. So really and truly his exercise and just a regular like balanced diet is the best thing. Making sure I would keep him on the skinnier side of things is the only thing, just because added weight probably doesn't help as far as like tendon and ligament support. So yes, and happy to have a more extended conversation with you at the time. So Connie, do you ever prescribe more than 1% tablet per day? So sometimes, yes. So essentially we'll start most horses out on 1% tablet a day. And then essentially I'd like to kind of recheck them in about like 2 to 3 months, and see that our ACTH levels are going in the correct direction. Sometimes if they're not, we will kind of increase them to 2 tablets a day. But some of my friends were like, we go up to like 3 or 4. But I start looking for kind of other things to kind of do concurrently, Connie, if we're getting to more than, if 2 isn't doing it, then I start saying like, what else can we look at to help these horses? And so there's kind of some older fashioned treatments that we can also look at as well, but percent by far is the gold standard. And so hopefully with, like I said, most horses, if they get 1 are just fine, and definitely 2. So it's not the typical to do more than 1, but it does happen. So I'd say, I don't know, like 20/80, if I had to say that. So I wouldn't be afraid of giving 2. I would just watch to make sure that their appetite keeps up after you add additional 1 in. Good. And then Kathy, I was told my horse tested positive for Cushing's. He is not showing signs of this, so he did not want to be put on percent yet. He's on a low sugar diet, a lot of soaking hay, etc. He suggested we continue to monitor him for Cushing's. He did have signs of PPID with fat deposits and crusty neck. Since this is a new diet, it looks good, feels better. Okay, so just wanted to kind of pull these 2 things apart here. So the crusty neck and the fat deposits is typically something we associated more with EMS-ID. PPID is the hair coat changes and the muscle atrophy. So Kathy, the first question I had is when they tested positive for that, were they looking at ACTH or insulin? Because for Cushing's, you'd be looking at ACTH, but some of the things you told me were more concerns I'd have with looking at insulin. And so I'm glad his diet changed and he's looking better. So he's half Arab and 18 years old. So he is definitely one where he could very well have both of those things together, in which case, if he truly had Cushing's, you should treat that with the percent or the pergolide. And if he had EMS-ID, that's the dietary part of it. So I think what I would probably start to do is, have a conversation with your, veterinarian about, which, did he have both of these conditions? Did he have just one of them? And then, if you haven't done challenge tests for the other one, like if you just looked at a baseline insulin and thought it was okay, I would strongly consider getting an oral sugar test done, given that it's an Arabian horse and they're prone to issues and he had a little bit of fat deposits and stuff. So, definitely at a spring checkup, I would say he would be one, maybe if you haven't checked him in a year, that you would do that combination test where you do the TRH stim test followed by the oral sugar test to really kind of get a full sense of what kind of endocrine diseases that horse has. If that makes sense, that is great. I'll kind of check in with Rebecca's, so we can go from there. And then, okay, beet pulp for PBID horses with ID, but is there concern about sugars and beet pulp? So there can be beet pulps that we actually have that don't have the added molasses in them or whatnot. So like kind of low sugar beet pulps, and absolutely those can be used for the horses that have PPID with ID. So that can do it, but just adding, vegetable oils slowly into their diet can be good too. So again, you'd have to look for the beet pulp that didn't have the molasses.